Hey everyone, welcome to another episode of From the Soapbox. My guest today is Dr. Kim Johnson, a veterinary oncologist and co chair of the 2026 AAHA Oncology Guidelines for Dogs and Cats. She is also the author of Positive Purrspectives, The Heart of Healing, a book promoting well being and resilience among veterinary professionals. We started off talking about the new oncology guidelines and why it was important to make them a resource to help general practice veterinary teams as they guide patients and their families through cancer diagnosis, treatment decisions, and referral coordination. We also talked about the importance of having workflows and other tools that remove some of the stress associated with arriving at a diagnosis and having sensitive discussions with clients about their pet's prognosis with a focus on compassion. And we made sure to save some time to talk about her book as well and the inspiration for writing it, which was making veterinary medicine a sustainable career path through a combination of individual resilience training and collective work to make the workplaces and systems in which we move healthy and supportive. So, even though we talked about cancer, euthanasia, and burnout, this was a joyful conversation that reminded me of why I love this profession so much. And I hope it'll be the same for you. And now, without further ado, getting her time to talk from the soapbox, Dr. Kim Johnson. All right, Dr. Kim Johnson, thank you so much for joining me here on the podcast. So excited to have you here.
Thank you so much.
Yes, we just interacted a few days ago on the fabulous webinar that you presented for AAHA for the new oncology guidelines. So happy to have you generously giving more of your time here. So
Well, thank you. You're super kind. Thanks for putting up with me twice in a week.
it's been an adventure, but I have loved it. I've loved getting to know you, and I'm excited for more people to get to know you through this conversation.
Good or bad. We'll see how
Yeah.
that goes.
It's going to be great. It's going to be great. I can feel it. And so you were one of the co-chairs for the AAHA's new oncology guidelines that have come out, and I want to obviously talk more about that. But first, before we get into that, I like to often ask kind of about, like, I call it like your vet med journey, and just kind of share a little bit about yourself and kind of how you've gotten to where you are and what you're working on now, and why veterinary oncology, kind of what kind of drew you to that part of veterinary medicine.
It's a crazy story. I've wanted to be a vet since I was in the fourth grade. Career fair and seeing this doctor when I was in the fourth grade, I was like, oh, I think I want to do that. My dad was in the Army, and so I was around, despite being in an Army and being on Army bases or Navy bases, wherever we happened to be stationed. He always had a farm. And so I was always around animals, and it was part of my upbringing. So interestingly enough, I started vet school to do large animal. I wanted to do dairy farming and pig rations. And then I quickly realized that 2 a.m. is early or 30 degrees is super cold. And I was like, we might have to revisit this. And so interestingly enough, in my junior year of vet school at Mississippi State, I was on my surgery rotation, and just a whole bunch of masses were coming in. And I was like, oh, wow, surgery seems pretty cool. I like soft tissue, though, but I did not like ortho. And, you can't separate out a residency. And so I was like, okay, well, I don't like the bones. I don't like the drills. I don't like that part. But at the same time, as kind of a sad side note, my mom's family, some of them were developing cancer. And so it became a pretty big interest for me. And that's just kind of where it started. And then I started externships and doing all those visits to different colleges and universities, and seeing, that I like the oncology departments at those places. And the rest, I guess, as they say, is history.
I have to say that when I was in vet school, my oncology rotation was one of the most enjoyable and happiest rotations that I've had. And I feel like that is not like intuitive to maybe those who haven't been in it, but I loved I was not really ever considering doing a residency, but I loved my oncology residency rotation. I just loved everything about it. Everyone was happy.
Where did you go again?
University of Pennsylvania.
Okay. Yeah. So, well, for one, I'd like geniuses as your as your teachers. But you know what I think we think a lot about quality of life, or at least the majority of us do, and I think some of that comes across in the rotation, and so well, that makes me happy to hear, and I'm sure they'd be happy to hear that you said that too.
Yeah, I mean the clinicians were happy, the all of the team members were happy, the clients were happy, the patients were happy. I don't know. I remember we had a dog, a Scotty, who was like kind of like a three-peater. Like it was like her third cancer that she was
Yeah,
back
wow.
for, that had been treated, and she'd had like, I don't know, mast cell, and she'd had something else, and she'd had hemangiosarc, and she was like the happiest dog in the world, you know.
It's true.
And I have always carried that image with me when I talk to people about, talk to clients about chemotherapy, and try to say, like, it's whatever idea you have in your head, that's probably not what this would be, if
Right. And
if you were to
yeah,
pursue that for your pet.
I try to tell clients, you're kind of hard pressed to figure out which patient is here for chemo treatment versus a patient coming in for, a glucose curve, and so yeah, we all see the myths, we all have the misconceptions sometimes, we all hear the C word and we think doom and gloom, but it's just not always that way.
Yeah, well, I'm so grateful to have had that experience. I'm so grateful that it exists. We all know that it's not going to be, pursuing chemotherapy or advanced treatment for cancer is not going to be the right fit for every family and every patient for a variety of reasons. But for those who do decide to pursue that, I'm so grateful to know that it can be as positive an experience as it often is. Um, and just kind of like, in that same vein, I'm excited that a big focus, well, like kind of the primary focus of the new veterinary oncology guidelines were, to be a guideline that is specific to primary care teams. Because I think, a lot of us, some primary care teams are doing chemotherapy, but there are plenty who are not, who that would be an immediate referral. But there's still so many aspects of treatment of cancer patients and oncology that will have touch points that involve um, primary care teams. So what did that mean for you and for for the task force to have created these guidelines specifically for primary care teams?
So I thought it was awesome that they had been done previously and then, redone now. And going back to my residency, we always taught that you can do oncology in general practice. It's not just something that is specialized to a tertiary facility. Sometimes that's just communication. It may not even be that not every patient that I see gets treatment, but they just maybe needed a conversation, or some validation. And so that was super huge. And they're also the front line, right? Like in mentioning during that webinar, our family practitioners are the first. They're the first to see the mass. They're the first to have the conversation. They're the first to do the diagnostic tests. And so I think it's super impactful that then they have kind of a little reference to be like, okay, maybe I can't get in touch with my oncologist right now, or maybe I can't, refer this patient for 6 weeks. What can I do in the meantime that's going to allow me to help Mrs. Jones, feel better about what's going on with her pet? And so that I think is a huge kind of um, milestone to cross for our family practitioners.
Yeah, because as you said, there could be so many different reasons why either the family or even the primary care team can't access an oncologist as quickly as perhaps they would like to, or at all, even, whether it's answering questions or deciding about starting
Logistics,
treatment, or
yeah, it's too far away.
yeah,
Yep, yep,
making
yeah,
diagnostic decisions, all of those things.
right,
Um,
right,
Yeah, and so it's great to have kind of another resource to pull from, because we we all get asked those questions so often. And if we're gonna get into that in a little bit, the questions about like time and prognosis and percentages, and sometimes we just feel like we can't easily access that information. So I'm
right.
glad that now we have another source for that that's easy to access. And just
Yeah.
like kind of going along with that, like what when the task force was kind of sitting down and saying, okay, we're going to redo these guidelines, there are 4 primary care teams, like what were the main goals that you wanted to make sure you kind of checked off when you were kind of going through them and deciding what was going to go into it?
I think the biggest thing maybe is to have a workflow,
Yeah.
something that's repeatable, something that you can kind of see a mass and know, okay, the first thing I'm going to do is my physical exam. The next thing I'm going to do is aspirate lumps and bumps. The next thing I'm going to do is, X, Y, or Z. I think similar to the way we're supposed to look at radiographs, right? You get your system. You may not have the same system that every person does, but you get yours and you do that every time. So if you have some chart, if you have some 1, 2, 3, 4 steps, if you have this whatever, then it maybe helps to kind of avoid stress. It avoids, like I mentioned on the webinar, everybody's hair is on fire because they're freaking about what do I do next, or what do I tell this client, or I have to do it right now, go, go, go. But then also maybe helping figure out something earlier, so then maybe there's some treatment options later down the road. If we were to hastily jump into a surgery and then we get incomplete margins, or then we have whatever complication might happen, if we had just taken a beat and thought about some steps, gone through again, making sure we just kind of check some of the things off the box, then maybe there would have been a biopsy first, and then we would have planned for 3 centimeter margins, or whatever that situation might be, that on every single case that you encounter, you just kind of have the Rolodex of things to go through. I think that will make life a little bit less stressful, a little bit easier, a little bit kind of, again, more convenient, and then doing a lot of things that you can handle in-house.
Yeah, yeah. I think that's helpful to have that kind of framework to look back on, because, like you said, there are so many steps, there are so many decision points that can be involved in these cases, and times where you feel like, okay, well, we can't go back in time and do things differently. So how can we have this guidance and this support as we're deciding for future cases, how to best approach them, or at least if we're having to make a different decision, what are the things we need to consider? What are the things we need to warn the family about? Because we know not every case is going to allow for us to do everything exactly
All
in
the
order. We
diagnostic,
talk all
right,
about spectrum of care and all those things,
right,
but at least we know what we need to consider when we're making those decisions.
right.
And one of the things, I was going through the guidelines, one of the things that I really appreciated as someone who has been in primary care for many years was the charts that you had toward the beginning of the common cancers in cats and dogs. Um, they were quite extensive, and there was so much helpful information there. I imagine you probably had to really kind of scour the literature
Yeah.
to find all of that information. But it's so helpful to have it all in one place, organized that way. And particularly, we know that clients are going to ask, they're going to ask a lot, about survival times. They're going to ask a lot about prognosis, because they all, everyone is different, but they'll come in with these, if my dog's not going to live 5 years, that's the cutoff for me. But for someone else, it might be like, if I can get 3 more months where I can snuggle them at home and my kid can come home from college and, see them again, then I'm happy. So we don't know what that sort of benchmark is for them, but they're all going to ask. They're all going to ask those numbers when they're making a decision, and what's the likelihood it's going to come back, and all that kind of stuff. So um, what was the decision like to include that? Was that just kind of like an easy thing that we have to include this, or how did
No, it
how
wasn't.
did
And
that
what's
happen?
funny is that was my so as the task force, we were kind of broken into we broke we're AHA broke us up into different parts to take care of, and the charts was actually my section, along with another colleague. And the first day we got into our little breakout room, we were like, "Holy smokes! What Why don't they like us, and why are they so mad at us that this is the part that we got? Like why did this happen?" But then after a while, it kind of became one of those things where all of this is in textbooks, right? Or all of this is in journal articles, or all of this
Yeah.
is in Venn searches or whatever. But to maybe put it into a practical, fast to use format, and like you mentioned, prognosis is usually always one of the first questions that clients will ask, but also one of the hardest for primary care teams to answer, and especially maybe with confidence in that very moment.
Yeah.
And so, by organizing things by, common cancers, and then what the biologic behavior is, what your staging priorities might be, what your treatment pathways might be to go down. Like the biggest thing, what are some of our survival ranges? Maybe now our family practitioners feel more confident in delivering that accurate information or consistent information, and kind of more aligned with what the oncology standards might be. And then also kind of being a little bit more realistic, and then trying to use that in the general practice setting. It was a big endeavor, I'll say. And but it was actually fun to kind of see that work completed after it was over. But definitely, again, a reference. No one wants to go to Withrow McEwen and flip real fast through pages and try to get to what they can get to. So hopefully this is something that's, even though they're long, those guidelines are still pretty long. But they can flip to the chart and kind of get to that specific tumor type, and then kind of, go and maybe have some quick information for a family.
Yeah, I mean, that's something I'm imagining even in an exam room. The practitioner could pull up on a screen in front of the family and say, let's go to the AAHA guidelines. Let's see what the most recent information that we have on this cancer is. And you can see, like you said, the biologic behavior, prognosis, general survival times with and without certain types of treatment. So I can only imagine it was how much work it was for all of you. But, thank you for doing it, because it's, the kind of thing you put a lot of effort into every however many years it gets updated. But it's hugely helpful to those kind of in the trenches on the front
Well,
lines
well,
who are
thanks. That's nice.
having
That's
those
nice. Yeah.
conversations. Yeah. Um, and just in terms of like primary care teams, like there's so much in here. There's so much. There was like a whole section on like what's new in veterinary oncology. And I feel like every time I have a conversation with an oncologist, or I go to a lecture, I'm hearing about all these drugs and protocols and things that I've never heard of before. And I would imagine that, particularly as there are all these advances in human oncology, that veterinary oncology is kind of following along behind and saying, oh, well, what can we take from what they're doing and incorporate for our patients, and maybe vice versa. I've seen some studies where
Hmm.
the primary research is in animals, and then it has applications for human treatment. But like, can you pick out a few things from like the what's new category that you think are most maybe exciting, or different, that you think that primary care teams really should go kind of take a look at and check out?
Yeah, I think what we were hoping for with that, was knowing that there's kind of maybe smarter, more individualized cancer care. And so that starts with some diagnostics. Like, again, not everybody has access to CT or MR, but those things are becoming more and more standard of care. Whereas when I went through school, it was radiographs or physical exam, and you kind of stop there. I'm aging myself a little bit, but those were some of the things that we are having more and more access to, is better imaging choices, and then more opportunities. I think the other thing is knowing that, we have an earlier diagnosis, so we have more treatment options for a better quality of life. And going back to you mentioning drugs, when we talk about human medicine, veterinary medicine is about 8, 10, sometimes 20, kind of depends on what we're talking about, years behind human medicine. And so we don't have as many medical advances as they do on the human side. But when we have drugs like, we had Caladium, we had Libertia, and we had Canalevia, medication coming out like for diarrhea or things like that, that now we're getting more and more treatment options, not only just for even tumor types, but then also for maybe some of the side effects. And so I think that, is super helpful also for the general practice setting. And then kind of knowing that they're shared decision making, going back to referral, and not that it's a failure, but that it's something that, we can do as a partnership. And so that clients feel more empowered, our family practitioners feel more empowered. We feel like more is less transactional and more of a group, conversation and dealing for better cancer care. And it's not that our general practitioners have to do everything, but that they, again, going back to the workflow of maybe having some steps to be able to kind of help with some right decisions, and avoiding some of the pitfalls that we might see to help guide clients maybe more confidently through their options.
You mentioned diagnostics and things like CT and MR. I feel like the other thing that I'm sort of like hearing in the background throughout the years and maybe don't quite have a complete sense of where we are and what's practically and commercially available, or things like different types of blood sampling and other sort of like point of care type tests that seem like I keep hearing they're on the horizon for either cancer detection or cancer screening and that kind of thing. Is that something that is discussed in the
I don't
guidelines?
know how. That's a very good question. I don't know how specific we went into, like the IDEX Cancer DX test or
Mhm.
NuQ or those. I know for sure they're mentioned. I don't know how far we went into them. More so less than using them as screening, but as an additional diagnostic test to, if we got a positive blood test, then maybe that might lead us down the road of doing an additional diagnostic test. Especially when we might have some cases where we don't feel anything on the outside. Not all tumors happen
Right,
on the exterior, right? And so when we're trying to figure out why that calcium is elevated, or we're trying to figure out, why X, Y, or Z clinical sign might be present, then yes, those are some new tests that are on the horizon that are also helping and minimally invasive, right? Trying to
right.
do things where we don't have to do a biopsy, or we don't have to do something that the clients might be scared of that could be painful. And so those are, I think, up and coming and on the horizon. Yes, they're out there now. And so now it's a matter of getting the number of cases so that then it can be published as to stats being meaningful to have more clout.
Yeah, I think I'm glad that you mentioned too that, kind of the time frame where we're running behind human medicine, because of course our clients will come in and they may be having some kind of testing for like prostate screening or something like that, and wanting to know like, well, what's the screening test for animals? And for many years we've just been saying like, well, there isn't one.
Right. Right.
Um and I think, we're all kind of looking to the day when maybe there will be something we can put on like their yearly senior wellness panel or something like that. Is that something that you think we should be hoping for at some
I
point, at least
do.
for certain types of cancer?
Yep, it's a very common day, like you mentioned, for a client, unfortunately, to have had cancer themselves or currently be going through treatment, and then ask, "I received this medication. Do you give this to dogs with mammary cancer?" Or, "I have lymphoma. Is my cat going to get this same, treatment, or the side effect going to be the same side effects that I experience?" And yes, prostate, breast cancer, those things where we have very clear definitive markers in human medicine, I definitely think are something to be totally hopeful for in veterinary medicine. And again, just because being minimally invasive, something to watch for. Whereas again, you don't always see things on the inside that are happening on the outside with that patient. And so I think that would be, very encouraging for us to be able to one day say, yes, we do have the equivalent of a PSA, or we do have the equivalent of a BRCA. Yeah.
Looking for the latest veterinary news? Stay ahead of the curve with stories from the American Animal Hospital Association's digital, award winning newsroom, Trends. We're bringing you fresh stories every day, covering everything from the cutting edge clinical insights to helpful practice management tips. And it's not just articles. Watch videos, check out interactive charts, and learn more about the people shaping our industry. As an AHA member, you also unlock exclusive members only content designed to help you and your team thrive. Visit aha.org/trends today and sign up for Trendsetter, our newsletter where all of our stories are delivered to your inbox twice a week.
So yeah, something to definitely watch for in the
For
in the
sure.
literature as those tests come, as the research continues to evolve, and hopefully those types of tests become available.
For sure.
And I wanted to, so this is kind of like a multi-part conversation, because you have also done some amazing work as an author in another part of the veterinary space. You have written a book, Positive Perspectives, Positive Perspectives.
That's right.
Got to pronounce it right.
Mhm.
The Heart of Healing. So in addition to being an author of this very clinical guidelines, we've also got this book for veterinary professionals that talks about more kind of the wellness side of things for veterinary professionals. Can you talk a little bit about your book and what inspired you to write it?
Yeah, so we'll start with the title. So I tried to have a little, pun and play on animal
Of
things. And so it
course.
started out with positive. And then my friends were like, "Well, Kim, there are cat people too." And cat people
Uh-huh.
don't think of paws as kitten paws. I think of it, I guess, always as canine. And so I was like, okay, friends. And so I'll be PC and I'll be, I'll do all the things, right, and try to get both
The
aspects. And so that's where, because I thought it was
equal
going to be too cheesy.
opportunity.
Equal opportunity,
Yeah.
handbook. I thought it was going to be too cheesy to have the positive and the per, but then it was not, at least according
Not
to
in
my
our
friends.
industry. Not in our
Yes, yes.
industry. We'll
They're
keep
they're
that
like,
up.
don't you know who your audience is? And so but I've been an oncologist for 20 plus years, and we carry a lot. We carry grief, we carry uncertainty, we carry what ifs and clients emotional whatever, and we try to show up strong for everybody else. And then that translates not just to oncologists, but also just to the veterinary field in general. And so in seeing the time of burnout and compassion fatigue and all the things that I think that are happening in our profession, I was really, really triggered by. I was on a panel for new graduates, and it was for like a doctor mentorship experience. And one of the panels, so it was me, it was a general practitioner who'd been out for like 20 years. It was a mentor who I think he's probably in his 60s or so, and then there was a first year early career um, veterinarian, and she mentioned that she kind of realized at the end of her first year that she didn't think she had smiled for the entire year. And I
Oh
was like,
no.
"Whoa." I was like, "You are way too young. It's impossible for you to have a sustainable career if this is what has happened in your first year." And so we all, I mean, you could kind of hear the collective, in the gas in the
Yeah.
room of, "Oh no,
Yeah.
we want to help you." And all of your, if it's you, then there's a whole bunch of yous. And
Right.
so that's where a lot of it came, is thinking about, how do we stay connected, and how do we find outlets. And the other funny thing about the guidebook is that I don't read. I am not a reader, which is why it is like a workbook. It's like a write some
Okay.
stuff down. It's not 500 pages. It is. I was like,
Yeah. Yeah.
people are like, "What are you reading today?" I'm like, People magazine. It's
Nothing.
so I
Journal
wanted there to be
articles.
some. Yes, exactly. I wanted it to be something though where people could, do something, write some successes, write what made today a great day, write something that was bad, but then how you flip the switch and were able to, to change it. And from that, I'm actually hoping that I'll maybe be able to do one for technicians. I'll be able to maybe do one for early career veterinarians, just because it just seems that there's a little bit more that our whole profession needs. And after kind of doing, again, onco in the clinics and in the trenches for 20 years, well-being has kind of become a little bit of a new passion for me. So like I speak a lot more on well-being than I do oncology topics now. Um, and I just think it's part of hopefully making this a very sustainable career, because I mean we love it, and I want everybody else to that's coming into the profession to love it, and love it as long as we have too.
Yeah, I just want to say though that I'm so glad that in this panel that you were on, that when the first year grad said what she said, that the response was sort of a collective, we have to do something about this, and hopefully kind of enveloping of her, instead of well, this is the profession, you signed up for this, like if you don't like it, go somewhere else, kind of like suck it up. Because in previous times, and maybe in other settings and with other individuals, there might have been a at least a tinge of that. And so I'm so glad that that was not sort of the collective response, that the collective response was one of concern and care and wanting to, and recognizing that that was not a normal, or as you said, a sustainable
Right.
way to be in vet med. So
Right. I mean, when we, I again think about, I've been doing this for 20 years and I still love it, and so
yeah,
I'm like, whoa, what on earth? And part of that though, I think is boundaries. I was taught during my residency that boundaries are huge, and that's with clients, that's with colleagues, that's with our referring community. And so there are probably 5 clients that have my phone number. There might be 5 of my referral doctors that have my phone number, but we boundaries are huge. And I know that's hard, and especially for someone a year out. We're people pleasers, right? So how could I possibly tell my senior attending or my senior clinician or the mentor in my practice, I'm leaving right now to go pick up my child to go to ballet practice, or go take my son to basketball, or take myself to Pilates? How could we possibly feel like that's okay when we see somebody else still at the office an hour later, And so, and back in the day, that probably is something that everybody, yes, would have said. We're all here together till 9 p.m., even though I might have been the most inefficient one of the group, and so, yes, to see that we all were like, okay, it's time for us to step back and see what's happening in these practices, and see what's happening that we can help and make this not be a thing that's repeated when we have this panel again next August.
thank you for sharing that, and thank you for. I'm just grateful for all of the people who are really having that conversation publicly. I can just say, as a younger vet, as a newer vet, I struggled with that a lot. I struggled with that a lot because of those who were employing me, who were my mentors, who were working alongside me. Definitely displayed that kind of, you should never be worried about getting out on time, was like explicitly said to me. And I didn't hear anyone saying anything else. So
Oh,
that felt like the truth. Do you know what I mean?
right,
Like with a capital T, like, okay, of course not. I won't ever care about getting out on time.
right.
Um, so yeah, people really need to hear those messages.
Well,
Need to
because
hear
it's
it.
if you step back and remember that, yes, you say to that extra that staying at the clinic until 7 p.m. means the no you said to your family. It means the no you said to yourself. It means the no you said to whatever outside of that. There, for every yes, there is also a no.
Yeah.
And if you hear that your first year or your first 5 years, that's hard to get out of. And again, it's just not possible to keep joy or keep the love for the profession. You're tired. That's
Yeah. Yeah.
exhausting. That's
It
mentally and
is.
physically exhausting, and it's just not doable.
Yeah. I agree. I agree. And you had mentioned this before, the idea of, working in oncology. And we talked at the beginning, like, oncology is not doom and gloom all the time. It could be very fun and maintain good quality of life and fulfilling and all of those things. But even so, you are sometimes, at least part of the time, working with pets who are sick or do not have a good prognosis, or, come to a point in their treatment where they need to be euthanized. And you don't necessarily have like the puppy and kitten wellness visits to kind of like balance things out. How many times have we gone from a euthanasia in general practice to then doing like an
Wellness
8-week-old double kitten appointment,
wellness
and that
exam.
kind
Yeah.
of like, not that the euthanasia is always, this draining experience, because that can be beautiful and necessary, and we very much feel that it can be what needs to happen. But still, it can be hard holding the grief, as you said, of the family as they're kind of navigating that experience. So then, like, smelling puppy breath or having a kitten climb on your shoulder can kind of like heal a little bit of you again. you know? And so you miss out on that aspect, I guess, a little bit when you're not in general practice. Um, but I'm just curious to know, like, what of your oncology experiences, if any, sort of informed any of your insights in the book.
Yeah, so I think it's kind of twofold, and part of it's euthanasia, and like you mentioned, that it's not always the most horrible things. That's treatment too, right? That
Yeah.
even though it's permanent, that's treatment too. And so part of the reason I became an oncologist was the relationships with the family. So, like you mentioned, your three-peater, you might have seen a dog, while that doesn't usually happen in oncology, for 2 years or 3 years. So you might see a child that started out in pre-K that makes it to second grade, or someone that graduates high school. And so you get that relationship with the family. But then the other part of it is hope. If you can find out, there's usually always a reason why some families want to pursue oncology care, cancer care. And so it's, please help me just get this dog to the lake one last time in July, or please help me, not have maybe something happen to my pet on my birthday in 3 weeks. So it's hope, it's gravy, it's every day is hopefully giving this family just a little bit of hope. We know generally there's not a cure, but that kind of, then it's hard to carry that. So part of then the book was, yeah, realizing quality of life isn't just for our pets. Quality of life isn't just for the teams. It also then comes back to the person that's trying to deliver all that. And so it's, how do we have presence? How do we still have compassion? How do we still have boundaries? And then finding some meaning in some of our hard outcomes. And so that was kind of where I tried to wrap everything up in kind of a nutshell for the guidelines of that guidebook.
I love that. I love that. And you've already kind of partially answered this question, but I'll ask it just in case there's anything else that comes to mind. Just the idea of resilience and experiencing joy amid all of the challenges of our profession. Are like, what do you feel like has been most helpful to you? Like, I know you said you've been in veterinary medicine for decades and you still love it every day. Like, what are sort of like the top things that you feel like for you has helped you to have that be your experience?
I think it's having an outlet. I love veterinary medicine, and this is probably going to sound, I don't off-putting maybe, but I don't eat, breathe, sleep it. So I love, like, it. So it used to be Zumba. I love a little workout. I love a walk and talk with a friend. I love travel. I love eating experiences. Like, I think we all need outlets. We are nerdy. We are science based. We are, facts, but then we forget about fun. And I think that is, and maybe sometimes I have too much, but I think that is, and it does go back to boundaries. And I'll give a shout out to my mentors, Dr. Dudley McCall, Dr. Carolyn Henry, Dr. Kim Selting. They taught us one thing. I remember them saying when we were going through resident orientation, they said, "We will not be impressed with you being here at 9 p.m. in the veterinary teaching hospital." And they said, "You know why?" They said, "Because we won't be here." They said, "We will not see you here at 9 p.m. That means maybe you did something efficiently during your workday that kept you here till 9. The other thing was, cancer didn't happen on Fridays during my residency. And so it was emergency only. And I have actually carried that through my career too, which I realize is a privilege. But that was huge for me. And so as I made my schedule as a locum, I made my schedule as an associate oncologist, as I made my schedule as X, Y, or Z job that I've had, the hats that I've worn, those things have helped keep me grounded, and again, a sustainable, I think, career and happiness in doing this is, I know that I have something. I have to always have something to look forward to, whether it's 3 months from now, whether it's 30 minutes from now, whether it's 3 days from now. Just having the outlet of knowing, okay, I've got these 3 tough days that I've had at work, or 5 days, or whatever my work week is. I know that on Saturday at 2 p.m., I'm going to go walk with Emily and do, this or that, or, whatever the situation might be. And so I think that's part of what's helped, is just having an outlet.
Yeah, I was remembering while you were saying that. I loved everything you said, so thank you for that, and particularly the cancer doesn't happen on Fridays. Um, we don't have that luxury necessarily in general practice, but I was thinking back again to my oncology rotation, and I remember one of the things that I think contributed to this sort of sense of like serene, calm, and also joyfulness. Of course, I was a student then, so there are all the levels, like the students, the interns, the residents, and then there was the senior clinician. And so as a student, I would always be there, by 7 doing my soaps and this, that, and the other thing. And the interns and the residents would probably be there pretty much as early as well. But then there was the clinician, and she would breeze through the doors at like 9:30. And she and I was young at the time, and either like, oh well, she takes her daughter to school, so she comes in later. And I didn't really have a concept of, she was probably very busy and stressed and doing 10,000. I know as a mom now, that probably was no walk in the park
Walk
necessarily.
in the park.
But
Yeah.
she would come in and she would be in like, I don't know if people still do this, but like she would come in like her cute little like skirt and her like little wedge sandals and like her hair done and her makeup done and her jewelry and everything. And I just thought like she was the most elegant. Like I was just like in awe of everything about her. And she
The
just seemed
Princess Diana
so,
of
yeah,
oncology.
yeah. Like she was just so like happy and calm, and like she came in like, well, I mean, who knows? It was probably this scenario. I built it up in my mind, but like she seemed well rested, and she just knew everything about oncology, and she was so nice to everybody. And like I'm sure that she was just doing what she needed to do to get by, to like make it sustainable for her, and she was in a position where she could have a little more leeway to say like, I can't come in until 9:30 because I have to get my daughter to school. And um I know there are other people who are kind of starting getting things going for me, and all the patients loved her and the families loved her. And she could do no wrong in my eyes at that time. And I was like, wow, I want to be like her, and like this is the best place ever kind of thing. Um so just when we do what we do have control over of that in our lives, to say like, okay, I am going to put a hard stop here, or I am going to leave on time, or I'm not going to pick up another shift, or whatever that looks like. Or like, even if it's not directly veterinary medicine related, like I'm not going to make dinner tonight, because it's too much, I'm too exhausted, whatever that looks like for each of us, and however that changes over time. That's such a good reminder, to make those decisions.
Yeah, I know that it's not easy, and like you said, not everybody has the luxury of no cancer on Friday or the weekends. But it's not always that. It's, do we get Uber Eats, or do I spend 2 hours cooking, a chicken pasta, vegetable dinner? And so there are times when we do just have to say yes to ourselves for just that hour, or just that day, or just that whatever moment. To just keep your head afloat, and keep everything, the ship, in the right direction.
Yeah. Yeah, I appreciate that reminder. It definitely unlocked a core memory for me. So I I appreciate that. That was a nice memory to go back to. And in that same vibe, I like to ask everybody that I talk with just something that they're really excited about in veterinary medicine. Something, it could be something that we've already talked about today, something that's going on now, or something that you're looking forward to in the future. Just to kind of share that joy and excitement with everyone who's listening today.
Well, I think despite the fact that it might have sounded kind of a little negative at the beginning about that panel with that first year grad, but the knowledge that there are so many new people entering our profession, and the fact that maybe we do have conversations about compassion fatigue, or sustainable leadership, or practiceship, that we're maybe making an impact, and like having the conversation that this is possible, this is doable. This is some things that some of us have loved since the fourth grade or didn't figure out we might be a second career, whatever the situation is that we came into this profession. I just want everybody to love it as much as the people that love it, And so if we can do whatever that is to make that cultural shift, or to however we continue to have conversation and realize that the collective gas should be the appropriate response, will then make a profession of less, we're a high suicide, profession, right? So
Yeah.
how do we get that number down and work towards, again, having the profession that everybody loves, not being numb, not just going through the motions, but something that truly is doable and brings us joy every day.
I love that. Thank you for that reminder.
Of course, of course. And I'll say one last thing that kind of goes back to you talking about your mentors at your school. There was a mentor at another vet school that used to dopamine dress. And at first we thought she was quirky, and we thought she was strange, and we thought she was weird. But I have since, in the past kind of 5 years, realized, like, oh my gosh, my color palette used to be black, a darker shade of black, a different shade of black, a different shade of gray, and maybe some white. And when I was feeling crazy, I'd throw in some navy blue, and so I realized, wow, color brings me joy, and so it's fun to throw on a pair of pink tennis shoes, or it's fun to throw on a red sweater, or it's fun to wear some colorful jeans or pants or prints or whatever. And so that also has made a shift in what some of the joy has been at work. Is I walk in and I'm like, oh my gosh, there's a cute little dog on my sweater. Like this, I don't know if you can see it. I don't know if you can see this. This little Frenchie,
Frenchie.
little
I love
Frenchie,
it.
you know.
I love it.
It's just fun things that then make, okay, Ken, how can you be upset? You're in a Frenchie sweater,
Yeah.
And so
Yeah.
those are also some things that maybe will help others, is that wearing black also sometimes means you feel like that. You know what I mean? And so
Yeah.
maybe just changing what we're doing on the exterior can also help some of the interior.
And I have to point out right now that we're both wearing pink. Just for
I
anyone
realized
who
that.
maybe doesn't see
We
the
both got the
video.
memo. We both got the memo. Yes, I was thinking that earlier. Yes. Yes.
And I was gonna say I'm always happier when I'm wearing pink. That is my color.
Yes.
And
Okay.
I embrace it. And I was just at BMX, and I think I wore something pink every single day
I love it.
because I could.
you
And one
could.
day it was like bright pink sneakers, just as you mentioned. And for those that are wearing like uniforms and they have to wear like gray scrubs or black scrubs, I mean, they could still do their little pops of dopamine, right?
So that was
Little.
my thing. Like I've never been really a makeup girl. I've never been really, but shoes is my, like, in my bio. Usually now I'll include that I have an unhealthy shoe addiction, and that's part of it, though. Yeah, if I was somewhere where I was wearing scrubs, I'm like, man, this is boring. And so then I started fun shoes. So I blame work on the reason that I'm a shoe addict. But yes,
Sounds
throw in a pop
reasonable.
of something.
Yeah.
Yes.
Yeah.
Socks,
Love that.
anything.
Love that.
Yeah.
I love that. The dopamine dressing. I love that.
Yeah.
Well, thank you so much for spending
Thank you for
time here
having
with us
me.
today. Really enjoyed this
This has been
little
lovely.
inspiration to start our day. So, or whenever anyone ends up listening to it, ending their day, in the middle of your day, a little pick me up. So thank you for sharing that with everyone. Is there any place that you'd like to share, or any way for those to follow you, or read up on the work that you're doing, or get in touch with you that you would like to share, a website or anything like that?
Yeah, so I need to do better. So one thing that I will say is that I'm grandma ish, I guess, in regards
No
to
worries.
technology.
No worries.
But on Instagram, I've worked on, I'm working on, and I'm having a team help me with, my Instagram handle is just be positive. And so
Love
it
it.
will hopefully have some more about, the guidelines, and just having a like every day for January, I tried to, or December, I tried to, like, put something, happy and hopeful and gratitude and things like that. And so it's not always veterinary related, but just something to maybe as a little pick me up. But then also there'll be some shout outs to when something else might happen, a volume 2.0, or a this whatever is happening in life in the veterinary world. So that would be probably the biggest place.
Perfect. And of course, they can look for your book, Positive Perspectives, The Heart of Healing. It's on Amazon and all the usual
Amazon,
places.
yep.
Okay, perfect. Wonderful. Well, thank you so much. I hope everyone has a wonderful day. Thank you, Dr. Johnson.
Thank you.